rural and urban communities. This is Terri Wisdom reporting to you live from Harlem Network News. Today, we are going to bring to you a town meeting with all of our Harlem public officials. We met with our public officials approximately 2 weeks ago, and they have been doing extraordinary work in that time. So we thought that it's very appropriate to come back to all of our public officials. We have currently, and others are going to join the meeting, we have our Honorable Borough President Gale Brewer. We also have with us her Chief of Staff, who is Athena Moore. We have our Assembly Member, Al Taylor, who is also with us. And we are expecting momentarily our great Congressperson from our District 13, Congressman Adriano Espaillat, who will be joining us. We are hoping that our Assembly Member, Inez Dickens, will be able to join us. She is currently attending and officiating at a memorial here in Harlem. And others that may join us are the mayor, his representative, Senator Brian Benjamin as well. And Bill Perkins has sent Councilman Bill Perkins has sent some position papers. So I think that we're well covered. So for those of you who are just joining, once again, I am Terri Wisdom, and I am your host for today for Harlem Network News. And for those of you who don't know, Harlem Network News is a new media platform that was created to provide information that is relevant to the Harlem community and urban communities of the world. It's very important because some of the major media really is not giving the real grassroots information. And we think it's very critical. Knowledge is power. So we are here to assure that our community is informed. We are going to begin. We have Dr. Jaquita Agby with us, and she is a New Yorker. You know, she also does work in West Palm Beach, Florida. She's a doctor of pharmacy. And we would be amiss if we did not really speak about medical things that are happening with COVID and how people can protect themselves. We cannot say it enough, because now that there are not like thousands of bodies that they're showing on television, and this is where media is the message, because people are not seeing those bodies because it's getting warmer. They're kind of, you know, putting this out of their mind. You know, it's a human trait for survival. But Dr. Jaquita Agby is going to bring some of those truths to us so that we stay vigilant. Dr. Agby, thank you.
Thank you for having me. So what we have here is a rush to pretty much, I feel like it's a rush to open up the states as a result of the economy, right? We have about 15% unemployment rate, 30 million people unemployed. And so the governments are looking at it like as, it's really like a financial thing to open things up over health, right? And so we have to be cognizant of that fact. Right now, I know New York is aggressively running a campaign for testing. The people that are most likely going to get tested or should get tested would be those that are in direct line, like the healthcare workers, anyone that's about to start work in phase 1 that they're doing right now. Most of the states are opening in the phase 1, so partially opening of the state. So those people, when you come back to work, you definitely have to get tested. Anyone that feels like they have influenza-like symptoms, that could be a sign of COVID. I know some people are a little bit hesitant about the testing. They're feeling like, you know, once you get tested, if you test positive, you're in the system in terms of data, which is important. This is how we're opening the states up. It's really looking at the data. So how do we know how many people are affected by this disease if we're not actively trying to test in the right ways? We're seeing a resurgence, well, not a resurgence. We're seeing children now being affected by it. At first, we just thought it was something that only affects the elderly and those with underlying issues. And now we have a presentation in children that looks like toxic shock syndrome or Kawasaki disease, where they have a whole inflammatory response. and it can lead to cardiovascular issues and heart issues. So that's something that we want to try to avoid, and especially as it's getting hot and people are just thinking about getting out of the house and getting tired of quarantining. We still have to definitely be vigilant in protecting ourselves and protecting our children and protecting the vulnerable. What we're finding also is that this virus is attacking a certain type of receptor in the body. It's called the ACE2 receptor. And I know we're looking at the African American population and why it's affecting us more. It could just be genetics. In addition to underlying issues, we know that 40% of African Americans do have hypertension as a result of diabetes and other comorbid issues. But it's if there's an upregulation, if more people have those receptors, if people have more of those ACE receptors in their body, definitely that's what COVID attacks, those specific receptors, which are pretty much all over the body. So it's a disease not only affecting the respiratory system, but also giving your immune responses and the cardiovascular issues. So you definitely want to take it very seriously and use your common sense when going back out into the world that's opening. That's what I have to say.
Okay, thank you, Dr. Agby. And were there any special things? I mean, I know that we all have been advised to practice social distancing, to wash our hands, to wash our groceries, and to be vigilant about signs and other things. But is there anything else specific? I know that vitamin D, they're saying people that were low and deficient in vitamin D are more susceptible. But is there anything else that we should look out for, particularly with the children? Because I think the jury is not out, and where can parents find out more information, and what should parents be doing to protect their children? Because I see a lot of people out here in Harlem with masks and they don't have the mask on their children.
Well, you gotta treat your children the way you would treat yourself. So if you were wearing a mask, if you were washing your hands.
Okay, thank you. Okay, so once again, for those of you who have just joined, this is Harlem Network News, and I am Terri Wisdom, your host for today. And we are, our meeting today is a town meeting with Harlem public officials, and we are discussing COVID-19 and also the pathology of racism, which the 2 weeks ago when we had Dr. Maulanga Karenga come on, he spoke about us, just fighting two viruses as people of color. And in these 2 weeks, it has come more to pass. We have seen the situation in Georgia with our departed brother Ahmad. It's a lot has happened. Jogging while being Black and shot. The treatment of citizens who are not wearing their masks by NYPD, a lot has happened. I'm going to go directly to you, Honorable Borough President Gale Brewer, so you can share some of what your office has been doing, what's been happening in the community, and if in fact, because I know before it was mentioned that there was a weekly meeting that happened with the hospitals. And I am just trying to find out what is happening so that we can get, as a community, some direct information. I understand we're not getting direct numbers as to who's being impacted, what the ratio is for people of color. And in order for us to really protect ourselves and take things seriously, we need to know what's happening. So Honorable Gale Brewer, if you would just stick with us. Thank you so much.
Well, thank you very much, Terri Wisdom, and you providing a great service with your Harlem Network News, and it's really an honor to be here. I'm obviously here with Athena Moore, who is the director of our Harlem Northern Manhattan office and who's a real asset to the entire Harlem community. I will try to answer some of your questions, and Athena should chime in. I must admit, my first priority has been food for seniors and for residents in the New York City Housing Authority. And the reason I say that is when we started this discussion with this horrible virus some 8 weeks ago now, there were real capacity issues in terms of food for NYCHA residents and for seniors. Here we are in the middle of May, and it is somewhat straightened out in the sense that the seniors can go to their senior center, or the senior center can add electronically any senior to the list to get quality, halal, vegetarian, or nutritious, whatever is their preference food. That doesn't mean that everybody's getting it, and those that go on the 311 Get Food system often get snacks. We can help them move on to the senior center program. That's the short version. NYCHA is another issue. You read in the papers that the morbidity and the cases in NYCHA are higher in East Harlem than maybe any other place in the city of New York. And NYCHA in general obviously had issues before. And when the elevators break or when apartments are crowded, we are not seeing the kind of support that they need. So we've been working with Fresh Direct. I think you know from the beginning. Fresh Direct volunteered and did pro bono for about 3 weeks for food from the top of Manhattan through many of the developments we work in Harlem, all the way down to the Lower East Side. And then I really pushed the mayor, and to his credit, he picked up the contract. So as we sit here today, 5 days a week, with our van and their truck, we are delivering food to the Harlem NYCHAs in a very substantive way. But there's never enough, as you know. Same thing in terms of PPE. We've all been allocating, but I have to say, even yesterday, I rode on my bicycle and I went to some of the NYCHAs in Harlem delivering the masks that we still had a few left of. So there's never enough, and we need more. I'm also continue along with the Assembly Member small business. We're not going to be able to open them in a way that we're going to lose. We don't want to lose our small businesses in Harlem. So we have been working, the Assembly Member's been working with Harlem Hospital, getting funding to pay the restaurants to feed the workers, and the same thing in East Harlem. We got some very large grants. 20 small restaurants in East Harlem are feeding the people who work at Metropolitan Hospital. But that doesn't take care of everybody. We really, some arts organizations, nonprofits, and small business, and you'll hear more from the Congressmen, got some PPP, which is the federal payroll money, but a lot of them didn't. So the whole issue of small businesses, there's a push to open up some streets, to relax the outdoor cafe rules, to relax the state liquor authority rules, so that those businesses in Harlem that are so iconic and so important get to continue. I won't get into a lot of details with the time, but I just want to say that's a challenge. In terms of the arts, which is what Harlem is known for, I want to give Rosa Rivers credit and Athena Moore from our office on, we've been having phone calls every 2 weeks with all of the arts organizations. Everyone's welcome in Northern Manhattan because they need information. We've met with the city council, a member who's in charge of the cultural affairs. On May 22nd, we're going to have the commissioner for media. We're going to have foundation leaders. We're hopefully going to have the new commissioner of cultural affairs and others who can help guide these amazing arts organizations that are not going to be able to survive, because normally what they get is box office revenue. That doesn't exist. So I think the arts organizations, we cannot lose them in Harlem, and there's a big, so join us on May 22nd at 6:30. I'm also very concerned about the whole issue of, as you suggest, I call it testing, tracing, and treatment. Now, in terms of what I understand to be testing, we have every weekday, we have I think it's a phenomenal newsletter, and we actually try to list things that others don't. As you know, the mayor and the governor don't always get along. So we put together the list of all the city testing sites and all the state testing sites on one list, because they're separate and sometimes hard to find. So right now there are testing sites at, as you know, at the hospitals, but also at Sydenham, at Ryan Health, at Dyckman up in 100 and way further north in Washington Heights, at the Institute for Family Health, and 21 Old Broadway, which is at 126th Street. That is for antibody testing. And as Terri Wisdom, you mentioned earlier, the governor announced today that he's going to have testing sites, I think, starting on Monday at CVS. And the mayor announced today, because God forbid they should announce together, that they're going to be tested, as you suggested, at City MD, or also called urgent cares. So hopefully that testing will give us a better sense in Harlem in particular what the status of people's health is. We are also concerned about tracing. What is tracing? My understanding from both a wonderful YouTube I had with a public advocate, Jamani Williams, and then also on May 12th, we had a wonderful YouTube discussion with Columbia University. My understanding is that the city's going to be hiring about 2,500 tracers. The state, for the whole state, is hiring 17,000. I don't know how many are from Harlem, and I don't know exactly what their process is going to be, but I can tell you that they're all going to be hired and trained by Johns Hopkins. They are then in the city going to start June 1st. So if I, Gale Brewer, am announced or am discovered to have the virus, then the tracers would go find all of the people I have been in contact with. So it is invasive, but it is good health, if done correctly, if the people hired represent the communities. So we do meet weekly with a phone call with the Harlem Chamber of Commerce to the credit of Lloyd Williams. And I suggested that the next phone call be the people who are in charge of tracing for the city and for the state to see how much is being hired, how many people from Harlem,
Yes,
people
that's
who are
very
hired, exactly, are supposed to have a health background. So who is being hired from Harlem and what is their procedure? That's what we want to know. We're also very concerned about the Harlem nursing homes, and I want to give Dr. Hazel Dukes credit in her role as chair of the Health Committee of Community Board 10. Without getting in again to all the specifics, a lot of people died. And the question is, what is the future? The governor has changed his position. People who have the virus are not being sent back from the hospital to the nursing home, which was, I think, a disaster. So I just want to let you know, we need to have a lot more oversight and communication with the nursing homes in Harlem. And then, of course, I mentioned the churches. The churches have been doing on a limited basis, Abyssinian and others, in terms of also doing things. They've been doing it last week until Sunday today, and in some cases they'll continue. It's all available on our newsletter, but also I'm sure you could get it from the mayor's information. And just finally, the issues to look out for are the summer, both obviously paying attention. It's hot now, social distancing. We could talk more about what the mayor's ambassadors are working now. They hired, I think around 2,500, again, same number, to start this past weekend, ambassadors. And I wanted to know, what is an ambassador? Well, it turns out it's mostly city workers. About 1,000 or more are from the Parks Department, and then the rest of them for the city are from other agencies. They are all, I believe, members of DC 37. And of course, the concern is how long do they keep their job? But supposedly, they are doing social distancing, not NYPD, which is a very good idea. We'll have to see if that actually worked. The Summer Youth Employment Program in Harlem, we want it to continue. You have phenomenal nonprofits in Harlem. We had a YouTube discussion with them. They have lots of ideas for how young people could be employed in a positive way, either virtually or helping all of the pantries get food to seniors and others. There are going to be a lot of people who do not have food this summer and beyond, and somebody has to help get that food and distribute it and pack it and so on and so forth with the pantries. In terms of the schools, that's the last topic I'm going to mention. I'm very concerned about the schools. I think that we obviously had bandwidth and broadband and device issues. That's one of the issues. But we also need, and we've just had a YouTube on this, a social worker in every school, more now than ever. Some schools have social workers. 700 schools in New York City do not, and many in Harlem do not. And it makes a huge difference. We're not going to know if we have summer school. We are not going to know school in the fall. We don't know if it's going to be a little bit of virtual and a little bit in the classroom. We don't know. We do know that a lot of folks are having employment issues. The eviction is on a moratorium until August 20th. I cannot imagine what the courts, unless we pay attention beforehand, what housing court's going to look like after that. So for a social worker who can address all those issues. So those are some of the challenges that we've been looking at. The health disparity in terms of African American, Latinx community numbers. I have most admit I've been focusing on NYCHA because I think that's where we can have an impact in my office. We know all the leaders, we know the residents, and we know the kinds of support that they need. So that's where we've been focused, but the impact is huge. And I think as a community board, elected officials, we definitely need to figure out how we can address this health challenge in the future. And Harlem Hospital has been phenomenal, so has Metropolitan. They need a lot more support, and we need many more community-based health in terms of the future of Harlem. Thank you very much, Terri.
Okay, thank you very much. And for those of you who joined in, this is Harlem Network News, and we are a new media platform here in Harlem, and this is our Harlem Town meeting for public officials on COVID-19 and the pathology of racism. And it appears, yes, and I apologize for interrupting, but I just wanted to share for those of you that have tuned in. Athena Moore is Chief of Staff at our wonderful Gale Brewer's office, our Borough President, and we have the fortune of actually having a storefront office here in Harlem on 125th, right by Amsterdam Avenue, that people can just walk in. That's amazing. It connects us with downtown, and it makes us be able to have access. So Athena, if you just wanted to piggyback and say a few words, and then we're going to go to some other questions that are on the table.
Thank you so much, Terri. I recognize that I am outside, so apologies if you hear any background. But just very briefly, the Borough President has really said it all. The only thing I wanted to add is that the census continues to be one of the issues that she's been championing with our Manhattan Census Count Committee. And right now, it's been reported that Manhattan is at the 50% mark in terms of completion, but we still have so much further to go, especially with specific pockets that are uptown. We did hear from Chair Julie Menon that progress has been made, but we know in Central Harlem and in parts of East and West and Washington Heights that we have to go deeper. And part of going deeper just means getting on the phone, making sure we're calling those individuals to remind them that it's really 15 minutes. It's 9 questions. It's not invasive. And we could work with anybody if they call our office at 212-531-1609 and help them to complete it. You can also now complete it online very easily or in the mail. So we want to encourage completion. Last thing I just want to mention, you had raised the question about the task forces that the city is doing. And while we are still waiting for information about who's on those task forces in terms of the racial and ethnic questions that have been raised, we do know that on the business and arts front, that some of our allies in Harlem, like Janelle Prosco from Apollo Theater and Melba from Melba's Restaurant, as well as Thelma Golden from the Studio Museum in Harlem, they are anchors that are currently appointed to the task forces. And if we see that they can be a bridge to this community, then we will continue to reach out and engage them. And we're still advocating for more, but I wanted to make sure you were aware of that. Lastly, the Borough President did not have the opportunity to mention, but I know she would want us to say, go out and vote. Absentee ballots are due very shortly. And if you have not gone to apply for an absentee ballot, it's very important that you do. The deadline for applying is June 16th, and election day is June 23rd for state and federal primaries. So please, 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 this is not a time in this pandemic for us to not vote. It's very important.
Okay, thank you, Athena Moore. And just for clarification, this is Harlem Network News. And I'm grateful that you did mention the census, because that's very critical to our community, and also the absentee ballot, or not the absentee ballot, but the ballot by mail. What do people have to do that? Because we want the community to be informed as to what people have to do. And I do see that our Congressman, Adriano Espaillat, has just joined us.
Hello,
So,
everybody.
thank you. How are you?
Very good.
So we were just talking, our Athena Moore, the Chief of Staff for our Honorable Gale Brewer, was just sharing about the census and also the importance of voting. So we're going to get some information for where to do that. But I would like us to come straight to you, Congressman Espaillat, and if you can share with us what has been going on in Washington. I know that we had the HEROES Act passed yesterday in Congress, and now it's got to go to the Senate. So if you want to just share what that's about, how it's going to impact our community, and how, in fact, if it does pass through, it's actually going to, you know, trickle down or up to us so that we really get the benefits of it. So thank you so much for joining us.
Thank you for inviting me once again. And thank you all for being here this Sunday. Let me just give you a layout of the scenario in Washington this past Friday and on the accounts of what occurred. First, it was a massive, very sort of like broad bill, $3 trillion. I think that the American people deserve that kind of investment. And it had a lot of provisions in it that expanded broadly across America, not just a narrow view of how we should help the country recuperate. One of those issues was how do we help immigrants, the undocumented? They have been left out of all previous actions. No help has come to over 12 million undocumented immigrants across the country. And the virus doesn't ask you for your green card when you get sick. And so we did include this time around a provision, which I've been championing along with others, that anybody that uses the ITIN number, that is a number used by folks that are undocumented when they do construction, where they do business with, to pay their taxes. So these are folks that pay taxes through an ITIN number, that those folks will be able to get some benefits from the package. Well, that triggered a motion to recommit from the Republican, the Republican minority. And it was a very tight vote. We had to defeat it, the motion to recommit. We felt, many of us felt, that if we couldn't defeat the motion to recommit, the entire bill will go down, because many of us were prepared to vote against the bill had the motion to recommit passed. But it was a tight vote, but we got it through, and then we were able to go the next vote and pass the HEROES Act, which provides that provision, right? Some benefits for people that use their ITIN number to pay taxes that are undocumented, but it also provides $100 billion for rental assistance. It provides a substantial increase for SNAP food stamps. It gives you another round of the stimulus money, this time $1,200, but also $1,200 per child, up to $6,000 per family. It also brings significant dollars to states and municipalities. New York City could stand to get as much as $17.1 billion, and the state could stand to get $22 billion in the first phase and another $12 billion the next year, plugging the budget hole in both the state budget and the city budget, that unless it's plugged, it will result in potential cuts to services and programs. And so this is important. As I said, the rent piece is very important, because people are going to be coming out of this shutdown in the pandemic with 3, 4, maybe even 5 months worth for backed up rent.
Wow.
And so they got to have the ability to come up with that money. And this bill allows for us to do that. It has, I think, a great potential. This is our vision. The previous bills that we voted on were passed on to us by the Senate. As such, some provisions in those bills were not necessarily what I agreed with, but we knew that we had to get immediate help to the hospitals, to the nurses and doctors, to small businesses. We had to get the ventilators in. We had to do all of that to save lives. So we were pretty much with our backs to the wall, and we had to hold our nose and pass that. But now this is our vision for the reemergence of America. And I think that is a good piece of legislation. In it also, we have money for public transportation systems, including $3.8 billion for the MTA. The MTA works on a ridership basis. Their formula for funding is based on ridership, and since their ridership has collapsed, they're strapped for money. This amount of money would put them right on track not to cut any services. And we can't go back to work. We can't go back to anything that may seem normal in the future unless our public transportation system is fully up and running. So that was one of the pieces of that I championed, was the MTA piece, as I am a member of the Transportation and Infrastructure Committee. I also championed the $100 billion for rental assistance, and changes were made to the PPP program. Very important changes that make it functionable. For example, businesses were pretty much strapped. Some of them got loans, but they had to put their loans into function in 8 weeks. And some of them are not ready to go back and open in 8 weeks. Some of them don't even have their employees in place. In fact, some of the employees don't want to come back because they're bringing in, some of them as high as $1,000 from unemployment benefits. So small businesses are having a problem bringing their employees back. They don't have to have those employees. They have to keep the number of employees that they previously had. Now, these changes do away with that timeline and push the program through December 31st. And it does away with the 75-25 model, which was also a problem for small businesses because some of them owe rent and it's more than 25% of what they got. And so now they'll be able to pay off their rent and they still have some money left to pay their employees when they come back to work. Now, all of this has to be approved by the Senate. And McConnell and the president already began to speak against the initiative, but I think it's a good, solid initiative. And I don't see how senators could go back to their states and tell people that they're not going to get another $1,200 check, or that they're not going to have their public transportation system working, or that they're not going to get any money to pay their backed up rent. I think that we will have to reach some kind of a compromise or a consensus. And I am hopeful that it will be a good one. I will keep the major pieces of this HEROES Act, which I think is a good piece of legislation. Thank you.
Thank you, Congressman. That is amazing information. And this is Harlem Network News. This is Terri Wisdom reporting to you live. Those of you who are on our Facebook Live, please share with your friends, family, your neighbors, all of your social media. This is critical information. Knowledge is power, and it has been a horrific time with this pandemic, but one of the great things that has come out of it is that we have all had to stand up to the task. Our public officials are standing up, they're fighting for us, we're in great communication with them. So we have to pick up the baton. You got to share this with your people. It's as important as anything else you're doing on social media, because this has to do with your life. This is an opportunity for us to make some change. We as people of color have been the hardest hit. So we really have to make sure that we take the best advantage of this. Now, Congressman Espaillat, because I know that there are a lot.
Well, Terri, can I just add one last thing that I forgot that I think is very important?
Absolutely.
Yeah. We also put lots of money for the 3 T's, right? Which is testing, tracing, and treatment. Because if we are to go out there, there's got to be a level of confidence. There's got to be massive testing. Reverend Al is getting a bunch of test sites open tomorrow in his district, right? He fought for them and he got them, right? Including Polo Grounds, I believe.
Yes.
Polo Grounds and some others will be open tomorrow. And so we must have massive testing across the community, right? And sometimes, even like a 10-block stretch, people are afraid, they don't want to walk 10 blocks. Some people tell me, I tell them, well, there's only 10 blocks away. They say, is there something nearby where I can go? A church or something. And so we got to have more of that, then we got to have tracing, and then we have to have treatment. And there's lots of money for that in this bill.
Okay, thank you very much for that. Just quickly, because you mentioned several things, you said they're expanding SNAP, the stimulus is coming back. If people have not gotten their stimulus, because there are many people, I'm talking to people, I'm surveying people, there are some people that have still not got their first $1,200, and then there was some information that came out that said, if you didn't file your non-filer by, May 5th.
They should call my office, yeah. I mean, people are getting, my son got his yesterday. He's got my same name. I opened up my mailbox and said, yes. It was his, he was happy about it. Yes, they could call my office and they can call either any of these numbers, 212-663-3900 or 212-497-5959. And your calls will bounce to my staff or myself, and we'll try to find out what's happening with. But one of the problems that's being faced by folks is that those folks that got money electronically in their account got those stimulus checks first. Those that didn't get, that got the physical check in the mail, are starting to get them now, right about now. Some of them have gotten it, but some they're coming in now. So be still. You should be able to get them, and if you don't, please call our office.
Okay, can you repeat the number for your office?
Yes, it's the two numbers: 212-663-3900 and 212-497-5959.
Okay, so that's great. So this is Harlem Network News, and also with the unemployment, I don't know if this is as well your area, but there are a lot of questions. And because everything is happening online, it's very difficult to people. They don't know where to, call anybody or do anything. And also, I mean, one of the issues in our city, and this has to do with our district, everybody does not have broadband. Everybody does not have a computer. And a lot of these things that happen have to happen online, including the education of our children. So what is in place that everybody in New York City is going to have some broadband access and going to have some access to, some equipment that they can get on there and do what they need to do? Critical.
I agree. And, again, I know that there's been a problem with the Department of Labor. I know the governor and the state government have been working on it. I'm sure you can call your assembly member. They can have a direct contact to the Department of Labor, or call our offices and we'll call on your behalf.
Okay, so thank you. And I guess they can update themselves on SNAP as well, because someone was—
SNAP is a 14% increase, yeah, but again, this is all just past the House. It has not passed the Senate, and already the Senate is pushing back on it. But I believe that we need, as the American people begin to pressure government, and we should all continue to pressure government to pass good legislation to help people across the country. And we're hurting economically in our pockets, and we're still hurting health-wise. And so we need additional help. And they can say, well, that's too much money. That's a wish list. I think $3 trillion is good for the American people.
Yes.
Okay, so thank you. And
thank you so much.
As we move along, if you let us know, and we could let our constituency know how we can put pressure, because as I'm saying it, this is a horrific time, but the fact that our public officials are standing up and we're being called on to stand up because we're really fighting for our lives out here. And I do not want our community to lay back. The weather's good. They are not, once again, the media is the message. They're not showing us pictures of body bags. We're not getting numbers as to what is happening in the hospitals. So people are kind of falling back a little bit. But
don't get tricked by the weather, no.
okay. Okay, so
Thank you so much. Thank you for having me.
okay, thank
I'm
you.
going to be jumping into another call, but I enjoy being with you every week. Thank you so much,
Okay,
Terry.
appreciate it, and we will bring you back.
I'll be back next week if you like.
Okay, fantastic, fantastic. And you and your staff are doing an amazing job and
Thank you.
putting us right inside Washington, where we have to stand up because we know so goes Harlem, so goes the world. Okay,
Yeah,
so
take care.
Reverend Al Taylor, we're going to segue to you. There was some information about the testing and the ones that you were able to secure in your district. If you want to let us know where those are and what people need to do to get that test and so on.
Good afternoon, Terry. Good afternoon, everyone. Thank you all so much, my colleagues. Gale is like amazing. Like I have my bike and I keep saying, I'm going to bring my bike out. Now she just punked me, so now I got to get my bike and put it on the street because Gale is on a bike. Oh, she's already everywhere already. And anybody that knows Gale knows there's no rock that's not turned over. There's no information she can't get. Gale, thank you so much. And that's just not a conversation we're having because she's here. It's real. And I thank you so much for your leadership. I've learned a lot. We're on the grounds. Terry, thank you and for what you all are doing. And I had this fake bridge behind me. Then when I saw my sister Athena sitting in the car, I said, I'm in a car. Let's just keep it 100. You know, I haven't seen my dad until today in 3 months.
Wow.
And I got a chance to see him, but I had to stay like a half a block away from him, but it was good. And now I have a good friend of mine. I'm sitting outside of his house because his father died this morning. Ooh. And it's just crazy. So we're moving because the other role that I play is I'm a pastor, I'm clergy. And so all of those things work together to minister to our communities, and you all are hitting some buttons. And I want to thank Gale for her leadership and everything she went through, the congressman for certain. Yeah, there is. And I want to, this is a disclaimer. I am not satisfied. There is not enough testing into my neighborhood, and it's too little too late, but I'm appreciative. I want to keep it 100. If you're telling me that my communities are rating high, why is it that 6 months, I'm exaggerating here, it takes this long to get it here? And I know it was the efforts of Gale, it was the efforts of Congressman Adriano and a few other people, because everywhere I go, I'm like this disgruntled black man, because in my neighborhood, the Heights in Harlem, there's not been enough testing. I know the governor is doing the thing with the churches. Praise the Lord. That's 100 people, and then they're gonna go somewhere else. I was just informed this afternoon that they're going to be testing in the Polo Grounds. And all the places that I've submitted between the mayor's office and the governor's office, they said, well, give us some potential sites. No one's come back to me and say, those don't work, or what are the criteria for having a site? And I do commend them for being able to go door-to-door testing. But if we're gonna do this thing, we can't operate in a vacuum. We gotta all be on this together so that people aren't gonna open their door. We don't test well like that. You wanna do who? You better get up out of here. So we need to bring familiar places, and I know it's first responders and medical people that are qualified to do the work, but we don't operate like that. And that needs to be understood and communicated, and I will keep saying that over and over again. We're getting tons of conversation regarding unemployment insurance. There was, and I want to thank Speaker Hasty for Friday, I think it was, I can't remember, but he had the commissioner on with the majority of the folks, my colleagues in the Assembly, and we was like a 3-hour marathon about the things that are not happening, what they need to do. They talked about the crash. They're doing it a different way. But if you're out there and you need to help, contact my office, 212-234-1430. 212-234-1430. That's one way to do it. The other way is Taylor A, NewYorkStateAssembly.org. Taylor A at NYAssembly.org. Send it, and we will put it in the portal and make sure we can get some traction if you haven't gotten. Keep in mind, they are now asking for your social security number. We tried to do it where you could only give 4, and the commissioner said they're not equipped to handle it that way. It's a longer process. So if you give us your social security number and be very reluctant to who you give it to, just don't throw it out there. That's your ID. But if we have that, we're going to put it in the portal and see if we can get some updates. We were looking for a legislative person that will handle legislative relations, but we haven't fine-tuned that. That's one thing that's going on. And I want to go with Sister Athena. Definitely the 2020 census, we need to make sure, because every person that does not fill this out, we lose potentially $26,000 per person in that household that's not responding back. I was happy to be on a virtual with New York State, New York City, New York charter schools. We did 2020 census. Who is that? Nicole, oh my goodness, I'm blanking her name. She's gonna kill me, right? But she was there and a lot of information was shared. That was just a couple of days ago. Yesterday, I was happy to be a part of Robin Hood Foundation, brought in over 1,000 meals. The drop-off location was my church, Senator Bill Perkins, Senator Brian Benjamin, and you had Councilwoman from the East Side. Oh my goodness, I'm blanking. And Assemblywoman Inez Dickens was there. And this was a way to drop meals in and people came and picked them up. Plus we had walk-ups for over 100 people. So yesterday was 1,200 meals or better. During the week, I gave out with my team over 1,000 meals. So we're doing that. And to Gale's point, the food insecurities are real in the communities and they're growing every day. And the people that if you know the community, that they would rather not know you're hungry, let you know they're hungry before they take a meal. They're taking meals. There is a real issue going on right there, and we cannot have enough. I want to thank the Robin Hood Foundation. I want to thank the meals that I'm able to get from NAN and wherever else people are making contributions. You can never have too much. We're going to need Pampers. We're going to need everything. I think going forward, we need to look at cooling centers and what are the alternatives? What can we do? Because this is real. And I would echo what was said. Someone mentioned about the disparity. I'm going to claim it as a disparity between mask and no mask and how people are treated. And I want to give a shout out to NYPD. I was on the block with the 3-2 community affairs, and there was a vigil / memorial for someone that was killed a week earlier. That block had over 400 individuals. It was packed, and they were like, hey, y'all got to get back. And the people listened, and not one citation, not one arrest was made, but it was community, loving on community, and the officers doing what we asked and expected them, professional courtesy under the circumstances. And clearly nothing happened. But those officers reached out to me as a clergy. They reached out to other people. Can you come and be a part of this? Because we can't sit in the towers and say we want change and we don't put any skin in the game. We have to be involved and out there on the streets, such as what Gale is doing. I'm gonna get my bike and catch up with her. But it's important that we're out here and people know that we're here, not just for the sake of saying I'm your elected official, but we give a damn about our communities. And if you're not doing that, fall way back, way back. So I think I've talked long enough. I tried to mention everything, but Gale said everything. So I don't want to, but cooling centers are what's on the radar now. Food insecurities and cooling centers, we need to identify them sooner than later because we're going to hit it hard.
Mm-hmm. Yes.
Thank you again for this platform and opportunity.
Yes.
Thank you, Doctor.
Thank you for your passion, and thank you for the direct boots on the ground work that you're doing. For those of you that have just joined in, this is Harlem Network News, and I am Terri Wisdom, and this is our 4th town meeting with different members of the community. And we know that the work that we're doing is very critical and very important. We are getting the information to the people. We're bringing the political officials to the people so that you can be informed. And Harlem Network News, we need our constituents to make contributions. We need you to share the information about Harlem Network News. Public officials, if you're aware of any discretionary funds, grants, whatever they may be, to help us, Harlem Network News, keep this work going. Also, you mentioned Reverend Al Taylor, several of the foundations like the Robin Hood Foundation and all of the other foundations that are bringing things into the community. And we really must hold these foundations to task, which I see that you're doing, so that the funds that they have coming in are going directly to the community. If there are jobs for tracers or ambassadors or whatever they are, our community needs work, is willing to work, and this will level some of the playing field. You know, this goes into the area that we're talking about when we're talking about the pathology of racism. You know, here in this community, we're dealing with the disease of the coronavirus, but we're also dealing with the disease that was existing before. You know, in terms of the disparities, the food, this is only magnified what we're dealing with. So we honestly need all of these organizations and agencies that are doing like shows and programs and raising like, you know, $3 million in 8 seconds. We need some of that money to come directly. This is a wealthy country. So there is no reason for us who are the backbone of the community. We are the essential workers. So very, very critical that we be a part. Obviously, every senior needs an air conditioner, and every child, we cannot begin to talk about education unless every child has that tablet, and then there is broadband for everybody, because otherwise the conversation is null and void. Now,
can I add something, Terry?
Yes, sir.
Yeah, I neglected to mention on that line with the broadband, I had conversations well in advance before this hit with Clayton Banks, Silicon Harlem, and we were talking about that. And this pandemic drives home the point that it should not be a luxury, but every home should have this automatically, because it levels the playing field. And if we're talking about changing the narrative and what going back to school will look like, it can't happen without having this conversation and all the entities that need to come together to do that. I think it's going to be imperative. And I just want to piggyback on what Athena said earlier about it is time to vote. One of the things that we've been doing ahead of this is making absentee ballot request forms available in Spanish and English, and people want them. The Board of Elections is supposed to send those out to everyone. I just happen to have a couple of hundred, and I would drop them at places so people, if they don't get it, they'll have one that they can apply. And also the polls will be open in advance and they can vote on election day, but the smart move would be fill it out and request it. And if you don't get it back by a certain time, then of course you can go to a poll, but anything else we can do in the middle, we want to help you.
Terry, it's Gale. I just want a couple of things to pick up on the Assembly member. First of all, the NYCHA has $55 million in city dollars for air conditioners. So every senior should get an air conditioner. The NYCHA also has, but how it gets delivered and installed and, you know, probably challenging, but they should definitely in Harlem apply. And second, NYCHA is also allocating iPads to seniors. There's a but. I got emails yesterday that the post office is delivering them to the lobby of a NYCHA building, and of course they're disappearing.
Wow.
Worse, NYCHA is delivering them to people who have passed because they're not calling in advance to state. So we have to, in addition to all of this opportunity, we have to hold these agencies accountable for doing the deliveries right. So I get very frustrated when I know government has good intentions and they're beyond challenging in terms of how their work actually gets done. So I just mentioned that as two things that we have to pay attention to. I want to pick up on the bandwidth. I've been talking about this for about 25 years. The disparity was very clear. It's not just for young people and their schoolwork. Guess what? Doctors are complaining to me that telemedicine is also going to have to be used even more in the future. Well, obviously seniors will have to stay home and others, and they can't, there's a long list, as the visiting nurses have told me for years, where you cannot do telemedicine because of a dearth of opportunity for bandwidth and broadband. So I just bring up these issues that are absolutely correct, and we have to address them.
Right. I'm very grateful for us being able to have this communication. I'm grateful because Harlem Network News is HNN, and we are the CNN of Harlem. bringing information to the people, just trying to open up the conversation, because these are things that have been going on for years. And this pandemic has, just opened it up wide because it has to. So I think we have to continue. Every person needs to reach out to another person. If there are people within the community that want to share their stories, share what's happening, because we're really, really not getting the information. Now, a question, it may be for you, Borough President, or for you, Al Taylor, Reverend Al Taylor. What is happening in our hospitals? What are the numbers looking like? I mean, has it all leveled off and no one's going to the hospital? Nobody is passing away? We're not hearing anything, and it's critical. We've tried to reach out directly to Harlem Hospital, to all of the people in charge. We want to hear from them, because I think that would be comforting to the people. We also did reach out to Mayor deBlasio. His people did reach back to us, and he was expected to be here. He should have been here today. He must be here the next time. We will make sure that he's here, because he's got to talk directly. There's a task force that has been set up 2 weeks ago. I understand money's been allocated for a task force on race, but nobody in Harlem is aware of that. If they are, please come and let Harlem Network News, because if there is a task force on race, then the mayor has got to come and talk to us so we can be a part of it. The same way we need to be a part of the tracing, we got to be a part of everything. Census, money is being made off of the community based on what we don't have. So it's got to come back to us. So if you, Honorable Gale Brewer or Reverend Al, want to just address those things and see what we can do so that it trickles directly to us. What's happening in the hospitals.
I'm looking to see if I have the statistics. I can say I sit on one of the states, and we discuss on a regular basis. The way it works, as I understand it, and the Assembly member can certainly jump in, there are obviously 7 ways in which the city can open, and the ones that are still challenging for the city are the ones that you just mentioned. There is a decrease in the numbers of persons, as the mayor announced today. Generally, I can't just be specific. I will try to get you the numbers for Harlem and Metropolitan, because that would be most relevant. I don't have them in front of me, but the city numbers for those that are on the ventilator are going down or in the ICU. The numbers for those dying are going down slightly. The numbers that are admittance to the hospital are pretty flat right now. The ones that are doing better, of course, are those that have, there are others that are, in terms of metrics, are doing better, but 3 have to go down so that it is less than 2 people per 100,000 who have the virus. So we're not there yet, right? We're about 3.5 as I understand it. That's citywide. So the question then is, when, what exactly is Harlem Hospital? What exactly is Metropolitan? And we will try in the next week or so to get to those exact numbers. But I think it's generally across the system, improvements, but still not at the level that would allow us to open according to the governor's metrics.
Yes.
Okay, and Reverend Al, did you want to add something to that?
No. I would agree with the Borough President 1000%. I don't have any data in front of me. I did make some notes on the call that we were on. I can't remember. It might have been Thursday or Friday.
Okay.
But I don't have any of that in front of me. But we can call it up, or Adriano, Espaillat, the Congressman's office, may have some of that data land right there in front, because it comes up in his weekly conversations that they have with Health and Hospital Corporation, a few other folks that are on that line. So I don't have anything beyond that to share.
Yes, we salute once again everything that you're doing, and anything that you can do to have the mayor come and talk to us, Harlem Network News, the voice of the people, we would appreciate it, as well as
good luck with that one.
Just putting it out there.
I'm with you.
That,
and I would say ditto. I'm back at you.
The mayor, the mayor will be here.
Good.
we're in conversation with him. He will be here
Excellent.
to talk directly to the people. Also, any of the philanthropic associations, we would love for them to come to talk to the people, to give Harlem Network, the voice of the people, support. We also have at least one question from the audience. We do have the owner of a child care center, which is Sugar Babies, Janae Shabazz, and she would like to know what she has to do. She is still trying to navigate her circumstance. We'd like to know who she needs to go to. We can put that in the text after. And we have several other questions that are here, just in terms of people want to know what they have to do for the PPE. There is, there's another question from Brooklyn with people that have not gotten their stimulus. So there are several questions that people are asking, many questions. And I would also like to add from Councilman Bill Perkins' office, one of the projects that he has been working on is the graduation process for our students, because there is some discrepancy. Is everybody going to graduate, like from the 5th grade to the 6th grade, or how is that going to be figured out? That's something that his office is working on directly. So if anybody would like to just quickly answer that, and then we're going to end with a quick medical moment, and we're going to and prayer from Reverend Al Smith, because we know. Yes.
Me?
Yes.
Oh, okay. I would say that with respect to the stimulus money, that they probably have a conversation with their congressperson on the federal level. And again, depending on how that money is coming to them, are they doing direct deposit? When did they file? It's an individual conversation, but I would defer that to their federal elected or to the congressman's office, because he left the number there. They can answer that stimulus question. With respect to PPEs, tomorrow, in fact, a big shout out to Bill Perkins' constituent troubleshooter, Keith Lilly, who's really on the ground with meals and doing just a fantastic job. And tomorrow, he and I and others, I think Senator Benjamin and I think Assemblywoman Inez Dickens will be at Red Rooster with the owner handing out PPEs, masks and gloves. As far as I know, I don't know beyond that. Anything other than that, I would have to get back to someone if they wanted to communicate directly to my office.
Okay, thank you. Also on Wednesday, Harlem Network News will be giving out food right at the corner of 135th and Lenox Terrace Way. We are working with the Muslim charities, and that'll be Wednesdays between 9 and 1. And Kennedy Center also gives out groceries to anyone who needs it, and that is every Wednesday between 9 and 1. And they were doing this before the pandemic. We will also be giving out gloves. I have one comment, and that is Vicky from Maryland. And she says that she watches national news every night. She watches MSNBC, CNN. And when the governor does his daily report, he's not mentioning Harlem. And we're hearing about the pandemic and all kinds of things. And that Harlem, this podcast, Harlem Network News, is in tune with what is happening in Harlem. And she just says that we need to keep up the good work. We have to really, and we have to, Harlem Network News, be supported so that we can keep going. This is vital work. It is vital, vital information. I'm going to go quickly, please. So support Harlem Network. You can support in many ways. Officials can support, encourage people to watch, to give information, give financially, so that we can be supported and keep going. I'm going to go to Dr. Agby briefly. She's just going to give us a medical 1 minute, 30 seconds, because this is what we're dealing with. Dr. Agby.
All right, thank you. So as the summer months are approaching, just want to keep in mind that don't get disillusioned, right? About the, the weather getting better. You still have to make sure that you're maintaining your social distance from others, wearing your mask, practicing good hygiene, looking out for the signs and symptoms of a possible coronavirus within yourself. So that would be fever, prolonged fever, muscle aches, sometimes people get gastrointestinal issues. And if you're feeling like you may have those symptoms, see if you get tested and go to your local ER. That's what I would recommend. And definitely keep an eye on the children.
Okay, thank you. And we are having testing going on in our community, and a lot of people are nervous about going for the testing. They're feeling like maybe if they go for testing, they can get it. So there's a lot of myths going on. Do you want to share? Because if it's going to take testing for us to open back up, do you want to share a little bit about this? And also we're going to throw it back to the public officials to assure that our community gets some of these testing jobs. Critical. So if you want to.
Yeah, I was going to say, I understand the fears that people are having. There's a lot of conspiracies going around and theories that if you get tested, yes, you might end up with COVID. That's not true to my knowledge. I really think it's important that we make sure that we're retaining data so we know how to track this disease and prevent the spread. And we all have to take responsibility individually to make sure that this doesn't happen, that we don't continue to have this virus going around. So it's better safe than sorry. That's what I think.
Okay, thank you, Dr. Agby. And we are going to close this session of Harlem Network News. We do see requests that we invite the public advocate, that's Pamela from New York City, suggests that we invite the public advocate, Jamani Williams, and I think that's a great idea, and we will reach out to him, and we do expect that the mayor will be coming and speaking to Harlem Network News directly. And like I said, this has been a horrific pandemic, but it's a time for all of us to be active and resolve some of the issues that are pre-COVID that have just been the pathos of racism in this country, in this city, and we just have to take a stand. I don't want to see another man, woman, or child thrown on the floor by police or any of those kinds of things. We have got to address these matters. We've got to address them seriously. We also, want to know what is the situation with our health commissioner, Barbeau. We've got to ask these questions because they're critical to what is happening in our city. And as citizens and activists, we have to get the answers, okay? It's a matter of life and death, and we've seen this. I want to thank so much Congressman Espaillat for coming on. I want to thank Gale Brewer for doing the work, and I'm inspired. I'm going to try to get on my bicycle too and move around. And
yeah, baby.
And Athena's and Moore, the chief of staff. There's a Harlem office right on 125th, right next to the fire station. Obviously, right now, we're not going. We're texting, we're emailing, but this is where they're located. Reverend Al Taylor's office is right there on 7th, about 148th-ish or 9th-ish. So Reverend Al, and thank you all. Thank you, Dr. Agby, for giving us those medical moments. Very important. I know you work with young people and you want to make sure that they're aware of what to do and what not to do and don't run out there. And Reverend Al, if you take us out in prayer and just keep the faith, and we know next week there's going to be more testing here at the Convent Avenue Baptist Church. It was at Abyssinia this week. Mount Nebo is coming. So let's keep Harlem alive.
Absolutely. Absolutely. Okay. Well, we certainly thank you, Terri, for all that you're doing here. Lord, we just thank you for this time together, and we stand on your promise. Your word says in Jeremiah that we ought to seek the peace of the city, because if the city prospers, so shall we. So, Father, we thank you for our sister Terri and those that are here today and those that are watching and listening through media. We just ask your favor upon them. And Father, there's so many things that we stand in need of, but you alone are able to do exceedingly abundantly more than we can ever imagine or hope for. So we believe your word, but we also know faith without works is dead. So encourage us, embolden your people to do even greater things, strengthen and let your favor be upon all those that are in need. We ask this in all blessings in the precious name. Amen.
Okay, amen.
Okay, thank you, Reverend Al.
There's a
And-
collection coming up. Ho, there's a collection.
Okay,
Don't you want to have authentic? No.
okay.
Bye-bye, Gail. Bye, everybody. Bye, doctor.
Bye.
Laugh a little bit. Thank you. And those of you who are on the line, please share with your friends. If you didn't catch this now, it will be on YouTube. Go to HarlemNetworkNews.com. Last week, we had a wonderful experience, Harlem Women Speak. And we will be doing some Harlem Men Speak. We also are going to be talking to our ministers and our churches. You know, so we're really just working to cover all bases of the community. And we're also going to be doing Harlem Youth Speak. Thank you so much. This is Terri Wisdom, Harlem Network News, coming to you live. Blessings, be safe, and continue the great work you're doing. And constituents, just come and support us. We need your support to keep going. Thank you.
Thank you.
Okay. Have a great Sunday, everyone. Thank you.
Okay.